Lower back pain. When people experience lower back pain, we commonly get asked if they could get referred for an MRI or for CT imaging. However, this doesn't always correlate to what you're experiencing in your pain. As you can see in this diagram, quite commonly we come across abnormal findings in healthy people. And what that means is we come across findings on an X ray or an MRI which would indicate that there is some damage to the tissue. However, these individuals don't experience any pain or any symptoms at all. So, because they don't experience their symptoms, they wouldn't expect that to be there. However, we do come across it. So, still, if we MRI or scan somebody who has got lower back pain, if we find, for example, disc degeneration, that doesn't necessarily mean that's what's causing your pain. As we age, we change. In a healthy joint, bone has a smooth protective surface called cartilage, which absorbs stress and shock within the joint. It allows the bones to glide over each other smoothly. In arthritis, the cartilage can become thinner and rougher, and therefore there is less shock absorption, and the movement between the bones isn't as smooth. As that cartilage becomes thinner, thickening of the bone can occur as the joint tries to repair itself. This commonly happens at the edges of the joints and it can lead to bony spurs and outgrowths. In a similar way, our disc changes too with age. When we are born, our discs contain about 80% water, and these discs lay between each vertebra and act like a shock absorber. Over time, they lose water content and therefore decrease in height, and that can lead to pain and stiffness. If you imagine a car tire, if it has more air in it, the ride is a lot more comfortable and smooth. But if the tire deflates and there's less shock absorption, the ride becomes a bit more bumpy. All these changes can lead to pain and stiffness. And then additionally, the muscles around the joint can become weaker. And if we think about these muscles like the scaffolding, if this scaffolding becomes weaker around the joint, there's not as much support. Factors which influence the way that our backs change. Age. Over half of the people at retirement age shows changes on the X-ray due to osteoarthritis, usually affecting people over the age of 50. Tissue changes are tissue changes as we age, and as we said before, joint changes on X-rays don't always correlate to the symptoms that we have. Gender. What we do find is that there is a higher proportion of women who experience uh, degenerative changes within their joints. Occupation. Certain occupations associated with joint changes. For example, farmers are more likely to have hip pain and plumbers are more likely to have knee pain. Genetics. There are thought to be some links between families and genetics, which may predispose you to having an earlier onset or more likely to experience degenerative changes. Lifestyle. Depending on your lifestyle and regarding your sort of like healthy living, you could be more likely to experience degenerative changes. For example, if you're not as active, we do find that there can be degenerative changes going on within the joint. Weight. Simply putting extra weight through the joints can contribute to an onset of joint pain and also lead the progression of it. Injury or surgery. So, any previous injuries to the joint, such as a fracture or surgery that you've had years before, can predispose you to having an onset of degenerative changes within that joint. And joint abnormality. So, if you were born or developed a joint deformity due to disease such as polio, you are more likely to develop joint pain in later years. Troubles with persistent pain. What we do tend to get is an increase in sensitivity of that lower back. So, pain is described as an unpleasant sensory and emotional experience associated with actual or potential tissue damage. And what that means is what we can experience is not necessarily the tissue becoming damaged is why we're getting pain, but because that pain is so persistent now, we get it where it's more sensitive. And that leads to generally being more tense and guarding muscles, and we become labored and more energy consuming with our movement, and generally weaker and stiffer. And it simply means that pain is linked to the many ways that we think, as well as the joint changes, and this leads to all of the above that we've just spoken about. So, if, for example, with our thoughts process, if we have positive thoughts, we end up tending having to have increased movement, we have better sleep, better function, and reduced pain. And then things that lead us to have worries or stress or fears can commonly lead to limited movement, poor sleep, reduction in function, and increased pain. When we're experiencing pain, we do tend to become more worrying and more stressful, and we fear movement sometimes, which is understandable. Tackling pain from both sides of the physical side and the psychological side helps us manage our pain a bit more efficiently. Take home messages. Lower back wear and tear is somewhat inevitable, but more wear doesn't mean more pain. Changes associated with having persistent pain, such as reduced exercise, are often problematic and under-addressed. Increasing activity levels, reducing stress, abolishing worries, and taking control of back pain will reduce your pain and improve your function overall.